Good day, everyone. My name is Gidget Shane T. Soliman, a first-year nursing college student that will perform a return demo about the assessment of lungs and thorax. Assess the thorax and lungs. The first step is stand in front of your client while she is breathing with the hands on the side while sitting on the examination table. Observe the skin and the anterior structure. Observe the client's posture, position, and the ability to support weight while breathing comfortably. Check the movement of the accessory muscles as the client breathes. Posterior thorax and lungs. Move to the client's back and perform the same observation, skin and the posterior structure. Palpate the spinous processes. They should be evenly spaced and non-tender. Assess respiratory expansion. Place the hands on the posterior chest wall with your thumbs at the level of T10 and press together a small skin folds. Observe the movement of the thumb while the client takes a deep breath. Please take a deep breath for me. Palpate for premitus by placing the ball of both hands. Ask the client to say 99 while moving the ulnar of the hand to each area. Assess corresponding areas of symmetry and vibration. Percuss for resonance, starting from the apices of the scapula and across the top of the shoulder, through the intercostal spaces, across and down until the lateral aspect of the bases of the lungs, comparing the two sides. Auscultate the posterior thorax as the client slowly and deeply breathes through the mouth. Assessment of the anterior thorax and lungs. Assess the anterior thorax. Begin with the bones and the muscles for retractions and accessory muscle used when breathing normally. Palpate for lumps and tenderness in the anterior thorax with the finger pads. Assess respiratory expansion. Place your hands on the anterior chest wall with your hands and thumb pointing to the sigmoid process and press together on a small skin fold. Observe the movement of the thumb while the clients breathe heavily. Percuss the anterior thorax starting from just above the clavicle down to the chest wall from side to side. Auscultate for the apical pulse for 1 full minute. Auscultate the aortic, tricuspid, and the mitral. Auscultate the anterior chest using the diaphragm of the stethoscope. The reason why that I perform it to my male client is that my female client is not comfortable performing that kind of return demo.